This video is presented by students from Taylor's University, Liao Mingzhen, Wang Jiaying, Wang Yuling, and Yuvan Raj on the topic of Nutrition Education Program on Childhood Obesity to instigate behavior change among primary school children. The target population is the primary school children which age between 7 to 12 years old. They are in a growing stage whereby they start to build self-confidence, learn how to be independent, and explore new skills. However, this stage is very important as proper guidance needed from parents and school. Since they spend most of their time in school, friends and school environment becomes the most important factors influencing them.
The problem matter discussed here is that the percentage of childhood obesity has been in an uprise over the recent years. When we look at a more holistic view among our neighboring countries, we are in second rank with 12.7% of the children and adolescent population showing an overweight status. It is also justified that 50% of the obese children tend to carry on being obese in their older ages. This issue should be addressed to improve the healthcare youths and the benefits of the future. When we dive down deeper into the prevalence of childhood obesity, it is noted that the causes of obesity can be distributed into various issues. The factors are lack of physical activity, which means less aerobic activity is practiced during their childhood. Moreover, poor dietary habits implanted to them from schools, and also genetic factors could also be an underlying issue. Hormonal problems and psychological factors can also be a cause of eating discretionary food which can contribute to weight gain. The risk implication of childhood obesity can be broken down into physical, social, and emotional complications. The physical risks are high blood pressure, type 2 diabetes, NAFLD, which is non-alcoholic fatty liver disease, bone fractures, asthma, irregular menstruation in girls, and many more. The social and emotional complications are low self-esteem, low confidence to upbring themselves, depression about their self-image, behavior, and learning problems. The objective of this nutrition education program is to educate primary school children on healthy eating habits and practices. Another objective is to ensure that nutritional practices such as healthy food preparation and nutritious food distribution are successfully carried out on school grounds.
To overcome this issue, here are the few action plans that are suggested to be implemented by the school. First, school should ban or reduce the marketing and provision of food that contain high amount of sugar, fat, fructose corn syrup, and carbohydrate, which can increase the risk of weight gain. Besides, the junk food can also be replaced by healthy food. For example, replacing the cheap ice cream, carbonated drink with low-fat milk, oat milk cookie, fruit, and nuts. In addition, schools should also encourage students to practice healthy diet, referring to guidelines such as Malaysian Healthy Plate and Food Pyramid. Proper education and information should also be delivered to students so that they can adopt a healthy eating behavior since young. Teachers can also deliver the related information to students through poster, game, and extra activity as to enhance their learning in the interactive way. For example, introducing the food that could provide them the essential nutrition, also the recommended calorie intake to the student. Schools should also help to secure the food availability and accessibility of every student. For example, provide free meal for students from low-income family or reduce the food price. This is to make sure that the healthy food that provide or served in school are affordable and available for every student. Free healthy food package or sample could also be distributed monthly as to introduce the healthy food brands or selection to the student.
Healthy cooking methods that can retain the flavor and nutrients in food without adding excessive amount of salt and fat should be practiced in the school canteen. These cooking methods can help reduce the calorie intake of the school children. The examples of healthy cooking methods are steaming, sautéing, roasting, baking, and poaching. Prevent deep frying and pan frying as the food can become more calorific as they absorb fat of the oil. Pack food into individual portions instead of applying the self-service concept. Studies have shown that portion size may be an effective tool in weight management as it helps in limiting calorie intake.
To evaluate the program, anthropometric measurements such as the height, weight, BMI will be done every 3 months. Also, teachers are required to be trained on this program so that they can teach their students about it. Fundings are needed for this program from Ministry of Health, The budget we propose for free food samples for each student is Rm5 per month and Rm3 per day for students from low income for their free meals. That's all for our video. Thank you for watching.